a dozen experts from the Foundation and other organizations came to my office outside Seattle for dinner. Over short ribs and salads, we turned to that key question: would COVID-19 turn into a pandemic? As I learned that night, the numbers were not in humanity's favor, especially because COVID-19 spread through the air, making it more transmissible than, say, a virus that is spread through contact, like HIV or Ebola. There was little chance of containing it to a few countries. Within months, millions of people all over the world were going to contract this disease, and millions would die from it. I was struck that governments weren't more concerned about this looming disaster. I asked, why aren't governments acting more urgently? One scientist on the team, a South African researcher named Keith Klugman, who came to our foundation from Emory University, simply said, they should be. Infectious diseases, both the kind that turn into pandemics and the kind that don't, are something of an obsession for me. Unlike the subjects of my previous books, Software and Climate Change, deadly infectious diseases are not generally something that people want to think about. COVID-19 is the exception that proves the rule. I've had to learn to temper my enthusiasm for talking about AIDS treatments and a malaria vaccine at parties. My passion for the subject goes back 25 years to January 1997, when Melinda and I read an article in the New York Times by Nicholas Kristof. Nick reported that diarrhea was killing 3.1 million people every year, almost all of them children. We were shocked. 3 million kids a year? How could that many children be dying from something that was, as far as we knew, little more than an uncomfortable inconvenience? We learned that the simple life-saving treatment for diarrhea, an inexpensive liquid that replaces the nutrients lost during an episode, wasn't reaching millions of children. That seemed like a problem we could help with, and we started making grants to get the treatment out more broadly and to support work on a vaccine that would prevent diarrheal diseases in the first place. Note, you'll hear more about how it turned out in Chapter 3. I wanted to know more. I reached out to Dr. Bill Fahey, one of the epidemiologists responsible for the eradication of smallpox and a former head of the Center for Disease Control and Prevention. Bill gave me a stack of 81 textbooks and journal articles on smallpox, malaria, and public health in poor countries. I read them as fast as I could and asked for more. One of the most influential for me had a mundane title: World Development Report 1993, Investing in Health, Volume 1. My obsession with infectious diseases, and particularly with infectious diseases in low and middle-income countries, had begun. When you start reading up on infectious diseases, it isn't long before you come to the subject of outbreaks, epidemics, and pandemics. The definitions for these terms are less strict than you may think. A good rule of thumb is that an outbreak is when a disease spikes in a local area. An epidemic is when an outbreak spreads more broadly within a country or region. And a pandemic is when an epidemic goes global, affecting more than one continent. And some diseases don't come and go, but stay consistently in a specific location. Those are known as endemic diseases. Malaria, for instance, is endemic to many equatorial regions.